Cell and tissue sampling in surgical diagnosis. Cell and tissue sampling is a critical component of surgical diagnosis as it helps in identifying the nature, extent, and specific pathology of a disease. This process involves obtaining cells or tissue from the body to study their structure and function under a microscope or using other diagnostic methods. Below is a detailed explanation of the process, methods, and its significance. Purpose of cell tissue sampling. The primary purposes include diagnosing malignancies, e.g., cancer, identifying infections and inflammatory conditions, assessing genetic and molecular abnormalities, determining the extent and type of a disease to guide treatment plans. 2. Types of cell tissue sampling techniques. A. Cytology, cell sampling. Cytology focuses on examining individual cells or small clusters of cells. 1. Exfoliative cytology. Cells shed naturally or manually from surfaces. Example, Pap smear for cervical cancer screening. 2. Fine needle aspiration cytology, FNAC. A thin needle is inserted into a lesion or mass to aspirate cells, commonly used for breast lumps, lymph nodes, and thyroid masses. 3. Body fluid cytology. Examination of fluids such as pleural, peritoneal, or cerebrospinal fluid. Helps detect infections, malignancies, or other abnormalities. B. Histology. Tissue sampling. Histology involves studying tissue architecture and cellular composition. 1. Biopsy. Incisional biopsy. A small part of the lesion is removed for diagnosis. Excisional biopsy. The entire lesion is removed for examination. Core needle biopsy. A larger hollow needle is used to obtain a tissue core. 2. Intraoperative frozen section. Rapid tissue freezing and sectioning during surgery for immediate diagnosis. Helps guide surgical decisions, e.g., confirming tumor margins. 3. Endoscopic biopsy. Tissue samples are collected during procedures like bronchoscopy, gastroscopy, or colonoscopy. 4. Punch biopsy. Circular blade removes a small cylindrical tissue sample, often used for skin lesions. Techniques for sample preparation and analysis. A. Fixation and embedding. Fixation stabilizes tissue architecture using chemicals like formalin. Embedding tissues in paraffin wax facilitates thin sectioning for microscopy. B. Sectioning and staining. Thin slices of tissue are cut using a microtome. Stains such as hematoxylin and eosin, H&E, provide contrast for cellular and tissue structures. C. Advanced techniques. Immunohistochemistry detects specific proteins or markers in cells using antibodies. Molecular pathology analyzes DNA, RNA, or protein alterations, e.g., PCR FISH. Electron microscopy examines ultrastructural details at a cellular level. 4. Importance of sampling accuracy. The diagnostic value of cell and tissue sampling depends on site selection, obtaining samples from the most representative part of the lesion. Sample quality, ensuring adequate, non-contaminated, and well-preserved samples. Pathologist expertise, accurate interpretation of microscopic findings. 5. Role in surgical decision-making. Cancer staging determines tumor spread and lymph node involvement. Infection identification identifies causative organisms and appropriate treatments. Prognosis prediction analyzes molecular markers linked to disease outcomes. 6. Challenges and limitations. Sampling errors may occur if the sample is non-representative or insufficient. Risk of complications, bleeding, infection, or injury to adjacent structures. Interpretation variability requires skilled pathologists to minimize errors. Conclusion. Cell and tissue sampling is indispensable in surgical diagnosis, offering invaluable insights into disease mechanisms, progression, and treatment planning. Advances in diagnostic techniques continue to enhance the accuracy and utility of these procedures in clinical practice.